I chose to do my research over the infant reflexes, and I chose to do this because I think it's something that is very important for people that work with infants to know. I've worked with infants for the past 5 years, and I see these reactions every day, but I've never been able to categorize them into the different reflexes. So I hope that through this PowerPoint, I'll be able to help you identify when an infant reaches these different stages. I'll start off by talking about the definition of infant reflexes. A reflex is an involuntary muscle reaction to a certain type of stimulation. Certain sensations or movements are known to produce specific muscle responses. I've also attached the URL to this site so that you can read more about the definition of infant reflexes. There are also infant reflexes that are normal just in the infant, but are abnormal once the child grows up. These include the Moro reflex. This is a normal reflex for an infant when he or she is startled or feels like they are falling. The infant will have a startled look, and the arms will fling out sideways with the palms up and thumbs flexed. The absence of this reflex in newborn infants is abnormal and may indicate an injury or disease. Some other reflexes that are normal in infants but are not as they grow up are the sucking reflex, the startle reflex, and the step reflex. There's also many alternative names for infant reflexes, and I've included these at the bottom of this page, and these include the rooting reflex, the parachute reflex, and the gasp reflex. I will also talk about 5 of the most common reflexes in infants, starting out with the palmar grasp. This is when you touch the palm of the baby's hand and the fingers curl around and cling to your finger or an object. This is when it's fun to play with babies with items such as keys or rattles to be able to grab a hold of it. This reflex also makes it difficult to obtain handprints until it disappears at about age 6 months. The plantar grasp is the next reflex I'll talk about, and this occurs when you stroke the sole of the baby's foot and his toes will spread open and the foot will turn slightly inward. And this reflex is usually gone by the first year. The sucking reflex is there as soon as the baby is born. Some people do not believe that this is actually a reflex, but this is how the baby ensures it will nurse on the breast or bottle. There's also the rooting reflex, and that's when you stroke your baby's cheeks and she will turn towards you looking for food. This is very useful when learning to breastfeed your baby and is gone by about 4 months of age. The stepping reflex is if you take your baby and place his feet on a flat surface and he will walk by placing one foot in front of the other. The tonic neck reflex is also called the fencing reflex because of the position of the baby assumes. Swimming reflex is when you put a baby under 6 months of age in water and they move their arms and legs while holding their breath. Some families believe in swim training for very little babies. It is not recommended for you to test this reflex at home for obvious safety reasons. Some examples of the reflexes that come in at adulthood are the blinking reflex, the cough reflex, the gag reflex, the sneeze reflex, and the yawn. I also attached the URL to this slide so that you can go and see more of the reflexes that come in at adulthood. At the end of this PowerPoint, I just added some different pictures that show the different reflexes that we went over in the previous slides, and also the Moro reflex. When I was researching to do this PowerPoint, I found this video about different infant reflexes on YouTube, and I attached the link so that you can go to that. I just found this little information. It says your baby will have his or her reflexes tested shortly after birth. Absence or weak reflexes can be caused by birth trauma, medications used, illness, or etc. Talk to your pediatrician if you have concerns about your baby's reflexes, or ask them to show you during a newborn exam the amazing feats of your new baby.